Okay, now we're going to do the supraspinatus. Now the supraspinatus tendon is underneath the acromion, this bone which is the top part of the scapula. It's right there underneath. We would have to have x-ray vision or take her acromion off in order to touch it, which would not be a good idea. So what we do is we rotate the arm internally. And if we rotate the arm internally, the tendon goes from here to here. And then we can access it with our hands. So what you do is you have the person put their hand behind their back, and they just relax. Now the tendon has gone to the front. So the first thing we have to do is we have to identify the acromion. And this little bone here that comes around, and you want to identify the edge of it right here. And then you're going to feel the humerus below it. And right between those two spots, you're going to find the supraspinatus. So let's draw that now. So here we have the bone. Okay, so if you just draw a little piece there, or just feel it with your fingers, that's right at the edge. Now you're going to look for the head of the humerus, and that's going to be just below it. Okay, so you got this little space here, and in between those two places, you're going to have the tendon. Now, if you feel along the edge of the acromion, you're going to feel a little bump. Right there is the bump. There's a little bump here. And so right below that bump, that's where the tendon is. And it's about that wide. And that's where the tendon is. And so it's not quite that long because these bones are a little closer together. But that shows you exactly where you're going to go to work. So the person is sitting. You're going to put your thumb right there. You're going to drag the skin away toward the chest. Press down. I'm pressing down right now onto the humerus, and the tendon is right under my finger. And then I go across and I snap over it. And as I go across, it snaps under my finger, boom, and we're back, boom, just like that. And I'm only doing the pressure in one direction, so the person gets a chance to recover, and my thumb gets a chance to recover. And I do it gently so that it feels just a little bit annoying to the person, not really painful. Remember, they should not be sore afterwards for more than 48 hours. If they are, you went too hard, lighten up. But always tell them they may be sore from 24 to 48 hours. And you're doing the treatment like that. Now you can also do the treatment standing to the side of the back. This is a good position, like this. And then you're going to be here, and you're pressing again down. You're pressing down on the humerus and back, so that you're compressing the tendon against the bone. And you're frictioning in one direction. The tendon is going up and down, and you're going 90 degrees to it, and you're frictioning it, breaking up the adhesive scar tissue. You do this for 5 minutes or 6 minutes. Then you rest for a moment, say a minute or so, and then you come back and do it again for another 5 or 6 minutes. And then you do some massage of the arm and the shoulder and the neck to increase the circulation. Don't go too fast, don't go too slow. And you notice I'm moving my entire hand. I'm not just moving my fingers. I'm moving my whole arm here so that I don't get tired. I could do this for a long time. I don't necessarily want to do it for that long, but 10 or 12 minutes is fine. It works like a charm, helping people to get better. After the second treatment or the third treatment, you add the exercise program, and it will increase the ability of the person to get better. You're breaking down the scar tissue. The exercise program is preventing the scar tissue from returning and building the strength of the structure. Tendons take 6 times longer to get strong as muscles do. So it takes about 6 or 8 weeks for this to be effective. And after you're finished doing the exercise program, they don't have to do that anymore. Okay, that's it.